This is our knee joint, also known as the patellofemoral joint.
Here's a quick overview of how we made our joint.
To start, we made our bones out of paper mache and layered it with Mod Podge. This video is sponsored by Mod Podge.
For all your synovial joint needs.
Okay, so this is our femur, and we have our medial epicondyle and lateral epicondyle, and then the lateral condyle and medial condyle, which are all made out of Play-Doh and clay.
And here we have our tibia and our fibula, which were made out of paper mache and paper towel rolls, as well as our patella, which was made out of clay, and the patellar tendons, which we made from balloons. Fun fact, babies are actually born without patellas.
Okay, so we use balloons to make all of the knee ligaments. So Sarah, could you help me?
Yes.
Okay. So the red is the PCL, the yellow is the ACL, and then on this side we have the LCL and the MCL.
So we also have muscles. Here we have our quadriceps. Here we have our gastrocnemius, which are made out of newspaper and pantyhose.
Also, the meniscus, Sarah's favorite part of the joint, is made out of foam paper. So you can see here it's in purple.
And right here, which we use plastic wrap for, is the articular cartilage.
Now moving on to the real T.
The knee joint is the biggest joint of the body and is the most vulnerable since it carries a lot of body weight.
Fun fact, the knee supports 1.5 times our weight when we walk and 3 to 4 times our weight when we climb stairs.
The knee joint is a biaxial synovial joint, but more specifically a hinge joint. This means that it only allows for flexion and extension, but also a small degree of medial and lateral rotation.
The knee is most stable when it's straight like this or an extension, and its main function is to connect the thigh and the calf, providing movement between the two.
The bones that make up this joint give it strength, stability, and flexibility. Fun fact, an elephant is the only land mammal that cannot jump because its body weight is too heavy for its knee joints.
The stability is provided by the 4 ligaments of the knee, like we talked about before as the balloons, including the ACL, MCL, PCL, and LCL.
So to start, we have the MCL and LCL. So here is our MCL, here is our LCL. And these are the outside ligaments known as the medial and lateral collateral ligaments.
The medial ligament attaches to the tibia over here, and the femur over here, whereas the lateral ligament attaches to the femur and the fibula. Both, however, limit the sideways movements of the knee.
Now we have the ACL and the PCL. So these guys are right back here, PCL red, ACL yellow, and these are known as the anterior and posterior collateral ligaments.
These 2 ligaments allow for smooth movement, they help with joint attachment, and they keep the knee from moving too far from side to side.
And the crisscross arrangement of the ligaments is important as it joins both ligaments at the center of the knee, allowing the tibia to swing back and forth under the femur without the tibia sliding too far forward or backwards.
The patella is a floating bone right here that requires tendons in order to keep it in place. These tendons are called the patellar tendons, and they're shown here in pink. Fun fact, the knee is considered as unique as fingerprints.
And now, what you've all been waiting for, story time. I'm sure we all know about my 3 concussions, various ankle and wrist sprains, Achilles tendonitis.
But Sarah, which one do we really care about?
Let's get to it. The infamous meniscus tear. It all started on the soccer field. I go in for the tackle and of course win the ball. But as I go to dribble away, the other girl aggressively pushes me to the ground. As I fall, I plant my left foot, causing my knee to turn outwards and hit the ground. I quickly got up to realize that I couldn't walk. This is the moment that I knew my life would change forever.
What Sarah didn't realize in the moment was that her meniscus was completely torn and she would need surgery to repair it.
So my injury consisted of a complete tear of my discoid meniscus, which is a very rare kind of meniscus as it's completely filled. So rather than having a C-shaped, it's more of a half moon. Luckily, I only got 3rd-degree sprains on my LCL and MCL because although holes formed in the ligaments, they didn't tear completely.
Wow, you're lucky they didn't fully tear.
Yeah. So the meniscus tear caused synovial fluid to be released in my knee, which caused a lot of swelling or inflammation.
Because of the buildup of fluid, her range of motion decreased significantly and was not back to normal levels until the swelling went down completely.
Fun fact, your meniscus holds up to 70% of the joint load due to its pillow-like structure.
For this reason, the treatment of the meniscal tear is extensive and mainly focuses on strengthening muscles around the knee.
Yeah, I even have a brace that took the strain off of my ligaments and meniscus before my surgery.
An MRI and several x-rays are some ways to indicate the specifics of the injury and what needs to be operated on. As we can see in these images, the lateral meniscus of Sarah's left knee is torn. Fun fact, the average cost for an MRI in the United States is $2,600.
There have been multiple medical journals and clinical trials conducted for meniscus injuries that are essential to the development of the treatment for this injury.
One that we researched involves whether exercise therapy or arthroscopic partial meniscectomy is more beneficial for middle-aged patients with meniscal tears.
After 2 years, exercise therapy showed more positive effects over surgery in improving thigh muscle strength.
Overall, the knee is an extremely important joint that is crucial to the fluid motion of our body.
Trust me, I would know. Wow.
Like
Stop! Stop!
I have to push you like this.
Yes. Stop!
Push.
This video is sponsored by Mod Podge for all your synovial joint needs. It all started on the soccer field. So rather than having a
The condyle and the lateral condyle.
wrong, have our tibia.
So we use balloons to make all of the knee ligaments.
We should.
When we climb stairs.
The knee joint is a biaxial synovial joint, but more specifically, a hinge joint. This means